My doctor told me my labs were normal. And you
This is
hear
what
that so much.
Oh my god, to the point where it's boring, right? But at the same time, I'm like, "Boring, but it's not." Hey, everybody. Today, the hot topic question today is, so you think you need more thyroid labs, and that's gonna solve all your hypothyroid symptoms. Right. Hey, everybody. I'm Maggie UMD, functional and holistic medicine and creator of the Transform Autoimmune Program and the Transform Program to turn around any autoimmune disease naturally. That's a mouthful. So, you have tons of hypothyroid symptoms, low thyroid symptoms. You've always been told your labs are normal. And what you think you need is more thyroid labs. True or false? Is that going to solve your issue? We have a new co host that I would love to introduce you guys to, who's going to be hosting with us. So, without further ado, I'm going to introduce Annie Manuel.
Hi, everybody. Thanks so much for having me, Dr. Maggie. I'm glad to be here. Let me tell you a little bit about myself. I'm a TV news anchor. I've been anchoring local newscasts for about the last 16 years. I've been working as a reporter as well. So it's really in my nature to ask questions and do a lot of research.
I want to up level what we're doing here with autoimmune education, and bringing a broadcast journalist into this and up leveling that conversation, and even more, a broadcast journalist with a huge health background in your own personal and family history. I think it's going to up level this for everyone in our audience. So, thank you for joining us. The biggest myth I think that we face in autoimmune disease is people, men, women, children, many of us have low thyroid symptoms. We know it. You know it right now watching, okay? Write down your symptoms if you already know you have low thyroid symptoms. And yet, we go to our conventionally trained regular primary care doctor or even the endocrinologist and we say, test my thyroid. We get a TSH and we get told, your thyroid is normal and you're fine, little lady.
And that's
Why
the
don't
only test you get.
why don't you go why don't you go take an antidepressant, and why don't you see a counselor, and or why don't you see another specialist? There you go. Let's do that.
Right.
That's the typical thing, is that people do get really mainly one test for thyroid. And then that leads to the interesting myth that people think, man, if I could only figure this out and I could get the right thyroid labs, and then I could
Mhm.
convince this doctor to do it, voila, it's going to solve all my thyroid and autoimmune health.
But would it? Because is there an issue here with interpreting the tests? Do the doctors know how to interpret it?
Well, this is a really great question, right? So for me, TSH is sure as hell not the only nor the best test for testing thyroid, yet it is the what we call the standard of care. And I myself, I've been in practice 26 years. My first 10 years is as a family physician with patients coming to me with all these symptoms and asking for labs. And I can tell you right now is that that is the standard of care. And even as a physician working for Kaiser, working for Providence, these major medical groups in the past, you guys don't realize it, but we are being judged on how much we spend on labs per patient.
Hmm.
So interestingly is we are limited actually, and we can be dinged. I was a medical director, so I was meeting with practitioners and saying, "Why are you ordering all these extra labs?"
Wow.
So there is actually a financial incentive and training and a corporate pressure for physicians not to want to learn more about the labs or order them. So you don't know what you're up against, which is why I'm loving the behind the scenes here, telling you exactly what's happening in your doctor's office and what their bosses are telling them, what the insurance companies are telling them. So there's layers of this, and people think, okay, I'll just go in, I'll figure out what tests I need, and then I'll go up and try to get these tests done. The problem is a lot of them will refuse to order the testing. Number two is this: you do not know what hell you're in for if you think you're going to figure out what are the best labs for your thyroid. It is a
Right.
very big, complex issue. First,
And
go ahead.
you go down the Google hole and you're spinning your wheels.
Yeah.
It, people are already commenting about this too. One person on Facebook said, "Hi, I didn't even realize I had low thyroid before the program. My doctor told me my labs were normal." And you
This is
hear
what
that so much.
Oh my god, to the point where it's boring, right? But at the same time, I'm like, boring, but it's not. It is literally this kind of dismissal that happens every single day, millions of times in the US here. But why is this happening? I can tell you right now, you going down the Google trap of trying to find what the right labs are, I'm going to tell you it's a big problem right there, number one, because understanding thyroid is really difficult. And I can tell you right now, as a layperson trying to understand a thyroid without proper education and mentorship, forget about it. But here's the
Mhm.
other problem, your doctors are even more ill informed than you are. Did you hear
Which is
that?
scary. It's very scary.
Your doctors are more ill informed about the thyroid than you are. And the reason is this: many of them have never experienced low thyroid or autoimmune disease. And so they don't know. And
Mhm.
they believe what they've been trained and they've been told. All you need is a TSH. If it's normal, go. They need an antidepressant. They need something else. Or nothing's wrong, go see somebody else, right? And they only have 10, 15 minutes with you anyway. So conventional docs have zero idea of all the steps that it takes to actually cause your what signals are your brain sending, what signals is does your thyroid getting from your brain, how much hormones is your thyroid actually making, what labs accurately reflect that, and then
Mhm.
what are the thyroid hormones that are actually active that actually does shit, right? And then what labs represent those, where do those steps happen, is it even your thyroid? Okay. So there are many layers: brain, thyroid, there's all these other areas that are involved. It's not just a thyroid issue. There's a system here that involves many different areas of your body. If you don't understand that and you just think, I'm going to order this lab, you're shit out of luck. And the funny thing is, even if you think you know something about this, your doctor knows 10 times less than you do. Because I'll be honest with you, as a practicing family medicine physician, all I knew was TSH. And if anybody else asked me anything else, I'd be like, oh, you don't need that. The gold
Right.
standard is TSH. That's what I've been told, the company line,
And
right?
that's what so many patients are hearing from their doctors as well. I mean, I'm seeing some of your alumni commenting, saying the same thing. Basically, had they not gone through the program, they would not have known that their thyroid was the issue.
Here's the deal. Like, there are all these layers from the brain to the thyroid to activation of these thyroid hormones. There's a lot of steps. And it took me to suffer from Hashimoto's myself, early menopause, multiple autoimmune diseases, serious pain points. Then, over the next 10 years, I've probably invested over $1 million in my own education to learn this. And then
Mhm.
to say, I'm going to teach people how to do that. Who the hell is going to teach a patient or other doctors how to do this who's a good teacher, who actually
Right.
has learned teaching as their passion, right? So for me, we're kind of in a perfect shitstorm between the blind leading the blind. And there's so many layers of thyroid that is completely misunderstood by your doctors. And it's not your fault, literally. And it's not even the doctor's fault. There's no incentive for them to actually what they're not sick with it. They're not going to
Mhm.
spend, 10 months or 10 years at a time or hundreds of thousands of dollars over 10 years to learn about this. Why would they? There is no incentive to do that. Their job is to get people in and out of the clinic in 10, 15 minutes if you're lucky.